Hi, I'm Dr. Lawrence. Today I'm going to talk to you about a very embarrassing topic for the person suffering, and that is snoring. So, it might be the role of the partner to bring out the topic and get into a discussion and probably find a solution for it. So, the question to ask is your partner snoring? Snoring by itself, it's not harmful. But if it is accompanied by sleep apnea, it could indicate a serious health risk. Are you having sleepless nights because of your partner's snoring? Or is your relationship a mess because of the audiological nightmare that you have been experiencing night after night? While millions of people across the globe suffer from snoring during sleep, the majority are simple snorers, also known as primary snorers. There is, however, a segment of snorers, approximately about 100 million people worldwide, that may have a potential health risk. In this video, let us talk about how to deal with a partner who snores like a pig. So in this video, let us discuss the basics of what snoring is and what to do if your partner snores throughout the night, giving you a hard time. If you are new here or have not subscribed to this channel, do like, comment, subscribe, and click the bell icon to receive updates of my health videos. And if you are interested in learning how to help your partner by preventing any serious health concerns related to snoring, be sure to watch this video till the end. People who snore often look like they are in deep slumber and are very well rested, while keeping you wide awake and terribly disturbed throughout the night. You would expect them to be well rested and refreshed the next morning after snoring like a pig throughout the night. But often, to your utter surprise and amazement, it is just the opposite. And then your partner says, "I had a terribly disturbed sleep last night. Hey honey, can I get a strong cup of coffee please?" And then they continue, "I'm so sleepy." Or worse still, "Love, please pass me an aspirin. My head is aching as if it will explode." And then you wonder why your head has not exploded yet. But before you fire your salvo of expletives at your partner, just remember that your partner's snoring might be a sign of a more sinister sleep disorder called obstructive sleep apnea, or OSA. Obstructive sleep apnea is the most common form of sleep disordered breathing, or SDB, a condition of repeated episodes of apnea and hypoapnea during sleep. Beware, snoring, especially obstructive sleep apnea, could indicate a deeper health issue in your partner, other than the gripes you are facing in your relationship. You should take snoring seriously because it might be the only indication that your partner's life may be at risk. So what exactly is obstructive sleep apnea, or OSA? Snoring is caused by the vibrating tissues at the back of your mouth and nose as turbulent airflow occurs through narrowed air passages. This laxity of the muscles and soft tissues at the back of your mouth and nose causes them to fall back on the throat, narrowing the upper airway. These lax tissues vibrate with the motions of breathing, causing the ghastly roaring or grunting sound you hear as snoring. Snoring and sleep disordered breathing are more common among middle-aged men, especially if they are obese, with short necks, smoke tobacco, consume alcohol, and are lying supine on their backs. According to a large population-based study by the New England Journal of Medicine, SDBs are seen in 4% of men and 2% of women. Approximately 7 to 9% of Indian adult population has sleep apnea, higher than those reported from other parts of the world. Sleep apnea is abnormal, short episodes of breathing pause during sleep. One should have at least 5 respiratory pauses per hour of sleep to term it as sleep apnea. Obstructive sleep apnea, or OSA, is a repetitive, complete or partial obstruction of the upper airway during sleep and causes snoring, reduced oxygen in the body tissues termed as hyperoxia, and increased carbon dioxide in the body termed as hypercapnia, and repeated arousals from sleep. While most cases of snoring may not be associated with obstructive sleep apnea, it is seen in about 10 to 25% of snorers. As it occurs due to obstruction of the upper airways, it is commonly known as obstructive sleep apnea or OSA. These short breathing pauses or apneas can significantly reduce oxygen supply to the brain and can induce brain injury in the long run, increasing the risk of heart and neurocognitive impairment. With the steady rise in the occurrence of obesity and an aging population, there is bound to be an increase in the number of people who snore and those with obstructive sleep apnea. Interestingly, most people with OSA are undiagnosed, untreated, or both, leading to a group of people at risk of potentially devastating metabolic and heart diseases. So now, should you be worried about your partner snoring? Well, the simple answer to that is yes, you should. While simple snoring is often harmless, if it is associated with obstructive sleep apnea, it may be an early indicator of an incipient systemic ailment. Snoring may be the only signal of impending long-term danger and must be nipped in the bud. Some of the common long-term consequences of untreated OSAs are: Number 1 is cardiovascular diseases like uncontrolled hypertension and heart attacks. Number 2 is metabolic disorders like uncontrolled diabetes and obesity. Number 3 is cognitive impairment, leading to increased risk of motor accidents. Number 4 is depression with increased risk of suicide. Number 5 is impotence and failed relationships. There are various studies that have clinically proven data to prove a significantly high prevalence of sleep apnea in the following medical conditions. Sleep apnea is seen in 80% of those with drug-resistant hypertension, 77% of those with obesity, 59% of those with pacemakers, 50% of those with congestive heart failure and atrial fibrillation and diabetes, and 35% of those with hypertension, 30% of those with coronary artery disease. So what this means is that sleep apnea is commonly found among those with these conditions and not the other way around. It is always a good practice to get your partner with a snoring problem evaluated for sleep apnea before ignoring it completely. Sleep interruptions due to snoring and sleep apnea can severely affect a person's quality of life. Morning headaches, sleepiness during daytime, lethargy and irritability are just a few of the problems that a person with sleep apnea suffers from. So what should you do if your partner has a big snoring problem? If your partner's snoring has been keeping you awake all night, or worse still, keeping you both awake and irritated, it is high time you consult with your doctor. Visiting your doctor is the first step in getting your partner evaluated for sleep apnea and any other dangerous ailments that may be masquerading as snoring. Reaching a definitive diagnosis of obstructive sleep apnea is the critical first step in the management of OSA, as it is a treatable condition. The following symptoms can indicate that your partner may be having sleep apnea: Daytime symptoms such as poor concentration, daytime sleepiness, early morning headaches, irritability, falling asleep during routine activities, nighttime symptoms such as loud snoring, witness pauses in breathing, choking or gasping for air, frequent visits to the bathroom, restless sleep. So, if your partner has risk factors like obesity, hypertension, stroke history, heart failure, or symptoms such as loud snoring, non-refreshing or disturbed sleep, gasping or choking at night, morning headaches, excessive daytime tiredness and fatigue, he or she should undergo a sleep test to rule out obstructive sleep apnea. Is there any tool or app out there to diagnose obstructive sleep apnea? While a sleep laboratory examination and sleep study is the surefire diagnostic method to label someone as having sleep apnea, a simple questionnaire called the Stop Bang questionnaire can be pretty helpful for screening snorers in the general population. Stop Bang is an acronym and represents a set of 8 questions that helps in screening snorers for the risk of obstructive sleep apnea. S stands for snoring. So the question is, do you snore loudly, louder than talking or loud enough to be heard through closed doors? T stands for tired, and the question is, do you often feel tired, fatigued or sleepy during the daytime? O stands for observed apnea, and the question is, has anyone observed you stop breathing during your sleep? P stands for pressure, and the question is, do you have or are you being treated for high blood pressure? B stands for BMI or body mass index, and the question is your BMI greater than 35 kg per meter square? A stands for age, and the question is your age greater than 50 years? N stands for neck circumference, and the question is your neck circumference greater than 40 centimeters? G stands for gender, and the question is, are you male? There are various mobile and web applications that have integrated the Stop Bang questionnaire and can easily help you with screening your partner for OSA. What if your partner says yes to 3 or more of the Stop Bang questions? The first step in the management of possible sleep apnea is a risk assessment using the Stop Bang questionnaire. The Stop Bang questionnaire will provide some proof of the existence of an issue. If your partner answers yes to any 3 or more of the Stop Bang questions, he or she may be at high risk of obstructive sleep apnea and needs to visit the sleep specialist for an examination and analysis. Once the risk is assessed by the sleep specialist, the affected person should undergo an overnight sleep test in the clinic or at home. After analysis and reporting of the sleep study, a customized management plan is chalked out for a person with obstructive sleep apnea. This involves consideration of the type and severity of sleep disordered breathing, the patient's age, the gender, BMI, the shape of the head and facial features, coexisting diseases, severity of symptoms, and its effect on the quality of life. This will provide the baseline to start various lifestyle interventions and, if needed, predetermined therapeutic modalities. So you might ask, is there any treatment for snoring and obstructive sleep apnea? Snoring without sleep apnea may be left alone unless it is disturbing the snorer's quality of life, especially if it disturbs a partner's sleep on a long-term basis. This could adversely affect your relationship, causing you to sleep in separate rooms, and it can even end up in separation or divorce. Snoring treatments can vary from simple lifestyle alterations to complex therapeutic modalities, even surgery in some cases. Lifestyle alterations include weight loss, reduction in alcohol consumption, or changing sleep positions. Some oral devices and nasal strips have been tried to some beneficial effect for those with simple snoring. Treatment of obstructive sleep apnea, however, is more complex and requires a diagnostic evaluation by a sleep specialist. The most effective and gold standard treatment for obstructive sleep apnea is continuous positive airway pressure or CPAP. CPAP is a non-invasive treatment where a gentle flow of air is provided directly through the nose and mouth using a mask to prevent the upper airway from collapsing. This allows the subject to breathe more easily by generating positive airway pressure, thus ensuring that adequate oxygen reaches the lungs. This oxygen subsequently reaches blood circulation and ultimately the oxygen-sensitive tissues such as the heart and the brain. While a CPAP can be extremely beneficial to the snorer and aids in the management of obstructive sleep apnea, it may feel cumbersome as a CPAP mask has to be worn over the face throughout the night and has to be tethered to the CPAP machine with a tube. All this can be annoying and limiting, especially if you have to be with your partner. The DreamStation Auto CPAP from Philips has a significantly unobtrusive mask with flexible tubing that easily adjusts to the various positions of sleep. This intuitive CPAP machine provides automatic breathing support, preventing airway closure in every sleeping position and synchronizes with the subject's breathing, providing a restful night for you and your partner as well. Dream Mapper is a mobile and web application that integrates with your DreamStation Auto CPAP and keeps you actively informed about your previous night's therapy, including your mask fit and therapy hours, ensuring that you get what's needed for a great night's sleep. Philips CPAP devices treat obstructive sleep apnea so that you can sleep better at night and be more active during the day. Are there any other alternatives to CPAP in treating snoring? Number 1. Oral appliances. An important alternative to CPAP in treating mild to moderate OSA is an oral appliance called Mandibular Advancement Splints, or MAS. These appliances are less effective than CPAP, but will improve the symptoms to some extent. The good news about oral appliances is that the compliance rate is about 80 to 90%, as compared to 50 to 70% compliance rate of CPAP. Custom-fitted appliances are more effective compared to the readily available, often poorly fitting and ineffective over-the-counter models. Number 2. Surgery. Surgery of the oropharyngeal soft tissues have been tried with some success, but often the risks outweigh the benefits. It is useful in a select minority of those affected by OSA. Various surgical procedures for the management of OSA include the following.
Tonsillectomy and adenoidectomy are done when abnormally large tonsils block the upper airway, especially in children. Maxillomandibular Advancement Surgery, MMA, with or without genial tubercle advancement, is useful in cases where CPAP or MAS has failed. MMA is a major surgery and carries a much higher risk. Multi-level or stepwise surgery, also called as MLS, targets correcting multiple levels of upper airway narrowing and has shown improvement in symptoms. Laser-assisted uvuloplasty or uvulopalatopharyngoplasty, UPPP, often fails to relieve symptoms and should not be done as the sole procedure. Bariatric surgery is shown to have dramatic improvements in symptoms in severely obese individuals. implantable hypoglossal nerve stimulator is useful in moderate to severe OSA patients who have failed CPAP therapy with good safety and success rate. Nerve stimulation treatment is currently approved only in the USA and certain European countries. The third alternative to CPAP is exercising the oropharyngeal muscles. This is an anecdotally proven way to increase the strength and tone of the soft tissues of the upper airway, thus improving the patency of the upper airway during sleep. Playing pipe musical instruments is a great example of this technique. Now that we have gone through the various modalities of treatment and methods of diagnosis, what does recent research suggest about OSA treatment? Generally speaking, CPAP therapy remains the most effective treatment method for obstructive sleep apnea and should be considered by all snorers who manifest symptoms of OSA. CPAP effectively reduces OSA severity and improves cognitive function, sleepiness, and blood pressure. While being compliant to CPAP treatment can reduce the risk of heart ailments in obstructive sleep apnea patients, it is not known to show any improvement of heart condition among those already suffering from the heart disease and present with only minimal sleepiness. Now that we have covered what snoring is, what OSA is, and how to diagnose it, and even the treatment for it, in short, what do I have to say about snoring and sleep apnea? Well, here it is. If you have been suffering long sleepless nights because of your partner's snoring, there is hope for you and your partner. You can screen your partner for OSA using the Stop Bank questionnaire. I have provided a link for you to get the Stop Bank questionnaire, so check out the description below. If your partner is at high risk, take him or her to a sleep clinic or a sleep specialist to get tested for OSA. If OSA is ruining your life and marriage, CPAP will save the day. Check out the links in the description below for amazing offers on your CPAP machine and peripherals. Before you leave, remember that sharing is caring. Once again, if you enjoyed this video, please do like, comment, and share it. Subscribing and clicking the notification bell will ensure you receive every update to this channel. For more fun health content like this, visit www.medicalisland.net. And before you leave, check out these other cool videos on my channel. Thank you and adios.